So, when you think of Bangladesh, what's the first thing that comes to mind? For a lot of people, it's a story of struggle, of poverty. But you know what? That's not the whole story. Not even close. Today, we're going to dive into one of the most surprising and honestly incredible public health transformations of the last 50 years. It's a true medical miracle pulled off against all odds. Let's get into it. Back in the early 1970s, this is what U.S. Secretary of State Henry Kissinger famously called the newly independent Bangladesh. Think about that for a second. An international basket case. At the time, it was the second poorest country on the entire planet, just ravaged by war and famine. The future looked, well, it looked pretty bleak. But okay, fast forward 5 decades. That whole perception, it's been completely turned on its head. From a basket case to a basket of innovations. Today, Bangladesh is a lower middle income country, and it's recognized not for poverty, but for its genius, world-class grassroots health programs. The big question is, how on earth did they pull that off? To really get a handle on this transformation, you have to look at the numbers, because the data, well, it tells a story that is just frankly incredible. It's a story of progress against odds that seemed almost impossible to beat. The sheer scale of the change is what's so mind-blowing. If you look at 1971, the year the country got its independence, the health metrics were just abysmal. But now, the improvement across every single category is just staggering. Let's break that down a bit. In just 50 years, life expectancy at birth shot up from only 50 years old to 72. That's a 22-year gain in life for the average person. Just let that sink in. An extra 2 decades of life. And for the most vulnerable, the little kids, the impact was even more dramatic. Mortality for children under 5 absolutely plummeted by a massive 88%. To put that into perspective, the death rate went from 251 for every 1,000 babies born down to just 31. We are literally talking about millions of children's lives saved. So this all raises a really important question. How did a country get so healthy while still dealing with so much economic poverty? This became known as the Bangladesh paradox, and it's a puzzle that has fascinated public health experts for years. Well, the answer wasn't in some fancy high-tech hospital or expensive new drug. Nope, the secret to Bangladesh's success was something far more revolutionary. It was a movement, a revolution really, that was powered entirely by its own people. So meet the heroes of this story, the community health workers, or CHWs. This was a national army of mostly rural women, many with very little formal education. They were trained and totally transformed into these confident agents for social change. They became the absolute bedrock of the entire country's primary care system. And their method? It was so simple, but so powerful. They literally went door to door, visiting every single home. They'd give family planning advice. They taught mothers how to mix a simple solution of salt, sugar, and water, a life-saving recipe called oral rehydration therapy to fight deadly childhood diarrhea. And they mobilized whole communities for things like immunization drives. This quote really just nails their impact. By bringing this knowledge right into people's homes, in a way they could actually understand and trust, the CHWs just completely demystified healthcare. They made it something for everyone. And you know what? That was the real game changer. Now, this whole community-first approach isn't just something from the history books. It has actually evolved into these super modern, data-driven systems that are now tackling some of the toughest challenges in global health, like saving mothers' lives when they give birth. It's a system with a bit of a long name, Maternal and Perinatal Death Surveillance and Response, or MPDSR. But the core idea is simple, and it's profound. You treat every single death of a mother or a newborn not just as a tragedy, but as a critical opportunity to learn, so you can prevent it from ever happening again. And the data they get from this is absolutely crucial. It shows that the main reasons mothers die, things like postpartum hemorrhage, which is severe bleeding after childbirth, and eclampsia, which is a really dangerous type of high blood pressure, those 2 things alone account for more than half of all deaths. And here's the key takeaway. Most of these are preventable with the right care at the right time. So their response is this constant learning cycle. As soon as a death happens, it's notified. Then local teams do something called a verbal and social autopsy, where they respectfully interview the family and the community to figure out all the different factors, social, cultural, medical, that led to the death. The point isn't to blame anyone, it's to find the cracks in the system. All that data is then analyzed for patterns, which leads directly to action plans to fix those cracks. But, and this is a big but, this incredible story of progress isn't over. Today, Bangladesh is standing at a critical crossroads. The very system that created this miracle is now facing huge new challenges that could actually threaten to undo decades of amazing work. And these challenges, they run deep. The public system is chronically, severely underfunded. Governance is a huge problem with a lot of corruption. You've got a private healthcare sector that's booming, but is pretty much the Wild West, totally unregulated. And the primary care system itself has to change to fight new threats, like the rise of chronic diseases. Let's just focus on the funding for a second, because this number is shocking. The government spends just 0.7% of its GDP on health. That is one of the lowest rates in the entire world. To put it simply, experts say it needs to be at least 3 times that. At least. And here's what happens when you don't fund the system. A staggering 67% of all healthcare costs are paid directly out of pocket by regular people. This isn't just a statistic. This means every single year, 5 million people are pushed into poverty just because they got sick and tried to pay for medical care. On top of all that, you have serious governance failures. There's widespread absenteeism, meaning doctors and staff often just don't show up to their jobs at public clinics. And meanwhile, the private sector has exploded without any real rules, leading one report to call it an uncontrollable monster. So this brings us to the final, crucial question. After inspiring the entire world for 50 years, can Bangladesh overcome these huge new challenges and finally finish its quest for health for all? As this quote makes crystal clear, the way forward all comes down to political will. You see, the easy wins, the low-hanging fruit, that's all been picked. This next phase, it's going to require bold government action, a massive increase in investment, and a total, full-on commitment to strengthening the very public system that served it so well. And that's where we'll end it. Bangladesh proved to the world that a country doesn't have to be rich to be healthy. The great unanswered question now is whether a richer Bangladesh will choose to be. Can that people-powered revolution of the past inspire the political courage that's needed for the future? Or will the very paradox that defined its success become its final tragic irony?